Good morning, everybody. We are very sorry for coming in late and the fact that you are not able to hear me. This is due to network issue, which has been resolved. Here this morning, my name is Oyebamiji Mrs. and I have with me Mr. Busari and e-tutor whom we took the course together. Okay, we move straight to NSC 406, which is Management of Nursing Services. And, you know, due to changes in healthcare system and complexity in the decision-making in healthcare system, there is a need for nurses to learn what management is in order not to be left out while making decisions in healthcare system. And then we move on to define what management is. In a layman term, management can be defined as the process in which the manager follows in order to achieve the organizational goals. You know, in any organization, either healthcare system or whatsoever, there are organization goals, there are aims and objectives which the organization wants to achieve. Thereby, the process in which the manager or the head of that organization follows in order to achieve that aim is what we call management. Another way by which we can define management is the art of getting things done through human resources, financial resources, and material resources. You know, in an organization, it is not only the personnel that will be needed. There will be the need for material resources and financial resources as well. So, reaching the organizational goal is through the process of planning, you know, directing, controlling, in which the manager follows, is what we call management. Then we move on to nursing service. Nursing service refer to the process which has been set. There are set of interrelated activities in which the healthcare organization aim at accomplishing. You know, in an organization, healthcare organization, there are some aims in which we are planning to achieve. This is what we call healthcare service. Then another one is nursing service administration. Nursing service administration is the process of planning, organizing, leading, and controlling, which encompasses the use of human, material, and financial and informational resources in achieving the predetermined objective. You know, the administration of nursing service, this is why we use the process of planning. The first thing is to plan, then we organize. There is the leading, there is the way by which we plan and we organize towards achieving the organizational goal. Okay, then let's talk about the objective of nursing service administration. The main objective is there should be continuous individual and group community service, in which when an organization, which is a health organization, is set up, there is the need for continuous individual, group, and community service, in which they will be able to increase themselves. Nurses will be able to continue their education. There will be room for continuous education for nurses. They will be able to participate in research. There will be training, and there will be personal development for nurses. And to the group and community, there will be continuous service in which we continually deliver a standard health care to the community in which the organization is in. Okay, who is a nursing service manager? This is someone that is appointed and given authority to utilize both material, human, and the financial resources effectively in order to achieve the organizational goal. You know, as the manager in the organization, in an organization, especially in healthcare as an organization, the authority to perform will be given to the person in order to be in charge of the human, the material, and all the other financial resources to aim at achieving the organizational goal. That's the work of the nursing service manager. And this can be our head of nursing, it can be our the director of nursing service, it can be our chief nursing officer, the SNO, and all of them, depending on who is the manager ahead of us. It can even be a nursing staff, depending on the situation we find ourselves. We are all manager at our own place. Okay, the managerial levels and roles. There are different levels of manager or in management. We have those that are at the top level. We have example of these people. They are the chief medical director. Those are the ones that head the organization. The chief medical director, you know, in the outside healthcare system, we can have the president, vice president, and the likes. Then we have the middle level. The middle level can be our head of nursing. You know, they are directly under the chief medical director, the head of nursing, our departmental heads, you know, depending on the situation. The next one is the first level. The first level can be our CNO, it can be the other nursing staff, the chief, the senior nursing officer, and the likes. You know, regardless of the level of manager we find ourselves, our primary aim is working towards achievement of the organizational goal. You know, the main thing is for us to aim at achieving the organizational goal. That is why in healthcare organization, there is no need for competition. We are all managers at our level, depending on the role that is given to us. We all have our own role, and we are all important in achieving the organizational goal. Take, for instance, a nurse, the doctor alone cannot function without the nurses. There is no way you can write out your order and still be the one to effect it. If there is no nurses to effect your order, there is no way you can, the aim can be achieved. The CMD as well cannot just work without the togetherness of the admin manager, head of nursing, and other departmental heads. That is why we need to stand firm as nurses in our, while taking decision. We need to contribute as well in order for them to know that we are also important. Okay, now let us move to the next one. We talk about the managerial levels and roles. Again, the managerial roles now. Managerial roles. The main role of a manager is to engage in planning, organizing, directing, controlling, and decision making. All these aiming at achievement of our objectives. It is the manager that does the work of planning. You know, they plan what is supposed to be done, and they organize them. After planning, they have write out their plans, they organize them. You know, later they give the role to people, those that are going to stand in at these who are going to be delegated for this role. Then they direct, they be the one to direct, they control, they see if we are in line, if they are working towards achieving the organizational goal. Then decision making, they decide, has this thing been able to achieve our aim? Have we been able to do what we want to achieve? Other roles of a manager, it can be interpersonal role. Interpersonal role is when the manager acts as a liaison officer. They can liaise for external and internal contracts. You know, or let's take, for instance, the CMD might have to liaise with the head of nursing service in order for nurses to be posted to a particular unit, maybe a newly set up unit. They might have to liaise with them, with the head of nursing, in order to in order to be for new nurses to be posted to a new unit which might have been created. Then informational role. Informational role is another role of a manager. A manager acts as a disseminator of information and also as a spokesman. You know, when there is any information to be passed across, it is the manager. Let's take, for instance, the head of nursing might have to disseminate information to, you know, the CNO, then to the CNO, continue like that to disseminate the information to the senior nursing officer, and like that, until it gets to the least person. And they also act as a spokesperson. They are the one that stand in gap for us, you know, and they pass the information across to us. Then another one is decisional role. Decisional role is the manager will decide and act as an entrepreneur, the resource allocator and a negotiator. You know, when there is any resources passed down to us, maybe from the state government, it is the decision of the manager to, the manager will decide where the materials should be distributed. And they act as entrepreneur. They are the one that decide if the hospital should be to be manufacturing maybe hand sanitizer in order for the hospital to gain more income. This is the work of the manager. Give me some minutes to sip some water before we continue. Number two. Okay, now we are back. Let's go on. Hope you also had time to relax. Okay, now let's move to elements of nursing management. Elements of nursing management, those are the ones I've mentioned earlier. They are the process that the manager will follow in order to achieve the organizational goal. As a form of his introduction, nurses as part of healthcare system, we meet with various health professionals, and this call for the need that we know about administration and management. As I've said earlier, in order not to be left out, in order for us to have a say while decision is being made in healthcare system. Elements of management now. As I'm saying this, I want you to assume you are the one that is the manager that is going to do this. So put yourself in this so that you understand better. I hope you understand me. Okay. Um, Organizing is the first one, and this involves identifying the roles of each staff. You know, as a manager, you identify the role of everyone under you. You know which task to give to this person. You know how competent each person is in order to be able to know which task to assign to such an individual. And this is um, towards achieving a common goal. So despite the fact that you give this person to do vital signs, does not mean he or she is the best at doing it. We just want to achieve the best results, and we want to achieve a common goal, as we have said. And organizing determines which work to be done. You know, we are organized. It helps us to be able to prioritize. We know which work to be done first and at what time do we have to do it. Organizing process, you know, we have different processes in under organizing. And this process include identifying the task, delegating authority, and then establishing relationship. You know, the first thing is you identify which task to be done. You know, maybe a weekly task, a daily task, a monthly task. Maybe when you get to work, you want to know, okay, these are the things we have to do today. You want to identify them. Then you want to delegate authority. While identifying, we are prioritizing which one to come first. Then we are delegating the authority, okay? You know, sometimes when we get to work, we allocate. We allocate work. This is the person that will do this. This is the person that will do this, and so on. Then we establish a relationship. While establishing relationship, we mean we are trying to look into the task to see that they are all interrelated. And at the end of the day, we all have the same thing that we are aiming at. Maybe for patient A to be discharged in 2 days' time, you know, depending on what we are doing. Then let's move on to the second element of management. The second element of management is staffing. Staffing. A manager does this work. You know, in a world when if you are the manager, you don't have enough staff, you request for more staff. And if it is the first level, I mean the top level of management, you know, the CMD or maybe the admin manager will identify that we need more nurses, we need more admin staff, we need this person, you know, they are the ones that will do the work of staffing. And staffing, by definition, is the process whereby competent people are selected. You know, there is the way we select competent people in the organization. People are selected through recruitment, you know, selection, interview, induction, and orientation process. These processes are followed sequentially. You know, when there is need to recruit more staff, after recruitment, maybe an advert will be placed for by the organization. It can be internal or external. They can recruit staff from the external. They put adverts on dailies, and when people see, they apply. Then that's followed by selection. Those people that are qualified, the best qualified candidates will be selected out of all the applicants. Then the interview follows. They conduct interview, which can be through verbal interview, it can be testing and all that, and it can be a written form of interview. After this, those selected will be inducted, you know, they will be inducted as a newly admitted staff. After this, they do orientation process for them. They are taking, they are being orientated on the do's and don'ts of the organization. We tell them what they need to know about the organization. So staffing is done in order to carry out the continuous work of management. Then the third one is scheduling. Scheduling is the third element of nursing management. And scheduling, when we mean is a form of timetable showing the planned work of a nursing staff. It can be per shift, it can be per day or per month, depending on what the hospital policy says. You know, we schedule our timetable like we used to do our roster in the ward. There's a way we schedule our work. We all know, okay, we have 20 staff, nursing staff in this ward, and this is the way we want to do it. We want 3 people to be on morning duty as our work. We are usually busy. We want them to be 5 We want how to know to be, you know, depending on the task in the ward. Those are the factors that you consider while doing scheduling. Other factors to be considered in planning shift are the types of patients in the ward. You know, you want to know, you want to consider the types of patients you have in the ward. Maybe you have patients that you have to be turning and shifting and lifting. You know, you want to put people that are FT, or people that are more competent in doing this lifting and all that. Then you can also consider the number of patients. The number of patients we have can also determine the number of people you want to put on the shift. Maybe you have like only two patients. If you have only two patients, you know, you might not need to put like 6 people on morning duty, and just be like 2 people, and then you give other people a day off, and so on and so forth. Experience of the staff is also considered. You want to put people that are competent on duty. You don't want to put someone that will rubbish your work as a manager, or someone that will not perform efficiently during the duty. Then you want to also consider the support available for the nursing staff. Do we have materials to be used? Do we have people that will support this person while on duty? Those are the things you consider as a manager while doing scheduling. The next one, which is the fourth element of management, is directing. Directing is the act of issuing orders, assignments, and instruction to staff in order to accomplish a common goal. You know, as a manager, you are the one that will do the work of directing. You direct them after delegation. You tell them this is the way to do it. This is the way to do it. To give the person order. As a nursing staff under you, you can tell the person, okay, you are the one that will do the inventory of this for this month. You know, you have issued your order. Then you can also give someone else assignments. You can give them instruction on how to do this, all to achieve a common goal. Then elements of directing can include communication, you know, delegation, motivation, coordination, and evaluation. Under communication, you know, you have to communicate with them effectively. You know, so that someone will not say, I cannot understand what you have said. You might have to put your delegation or order in writing for record purpose. And you know, there are some barriers which can affect communication. The person might say, okay, it does not, language barriers, we all know, can affect communication. You need to be sure that you are passing the information correctly. You are giving the order correctly. And in order not to, for your subordinates not to misunderstand you. Then delegation as well. While you delegate, you need to delegate effectively. You need to delegate and leave the work for the person to do. When you have delegated, you don't interrupt the person while doing the work, except the person is going outside the aim you want to achieve. That is when you can interrupt. Then motivation, you motivate them. When you see that they are doing well, you can appraise them. You can tell them they are doing well. It makes your work easier. They want to do more. Then coordination as well. You coordinate when need be. You serve as a supervisor, you supervise. Then you do the evaluation. You are the one that will do the evaluation. You want to see what they have done, if it's in line with the goal that you have set. Then we move on to the fifth element of delegation. Fifth element of management, which is delegation. You know, delegation is when the manager assigns a portion of his work to someone else with corresponding authority, responsibility, and accountability. We have talked about that. That is when the manager, you know, you want to shed some of your work to your subordinate. You want to give them opportunity to be able to showcase their own skills as well. You want them to do the work, you want them to do the work on their own, to be able to, you know, you are preparing them for the post of a manager. You want them to be able to act independently. You know, while you delegate, you give them corresponding authority. You let other people know that this person is the one that will act in my absence. You want them to know that this person has authority to sanction you when you do this or that. You know, that's when you give them the corresponding authority. Then responsibility as well. You give them corresponding responsibility. You let them know that they are the one in charge. You let them know they are responsible for whatsoever happened. Then accountability. You let them know they are the ones that will be accountable for whatsoever happened. Okay, what are the steps that we have to follow while doing delegation? You need to plan ahead. You know, as a manager, you want to delegate to someone. You don't just come up today and say you are the one that will act in my absence and you are leaving immediately. No, you have to plan ahead. You have to write out what you want to do. You have to write out the roles that you want the person to act in your absence. Those are the things. Those are the planning ahead. You have to tell them, okay, this is what you have to do while I'm away, or this is what you have to do in when you go for this meeting on my behalf. You have to plan ahead. You write down your plan. Then you identify necessary skills and level. When you are identifying necessary skills, you are looking into you are looking internally to your staff, those people under you. You want to know who has the best skill, the best knowledge in acting the way you want, the way you will want it to be. You want to identify the person. Then after that, you select the most capable person. In this selection, there shouldn't be bias because you want the person to act effectively. There is no bias that this is the head of, this is the person that is next to me in hierarchy. You know, the way we carry hierarchy in nursing is so important. You know, while they're doing delegation, you don't follow that. The person next to you might not be as capable as the least person in the world. Therefore, you need to be sure that the person is capable of doing the work before you delegate. Then you communicate the goal clearly. When we say clearly, we mean so that there won't be flop, so that there won't be misinterpretation. You communicate the goal clearly. Okay, this is what we want to do this is what we want to achieve. You let the person you are delegating know so that the person will understand better. Give them time to understand. That is why you cannot just delegate and leave immediately. Then you empower the delegates. You have to empower the person with, as we have said earlier, corresponding authority, responsibility, and accountability. You need to empower the person. Or if the person will need financial resources or the person will need some material resources, you need to provide them in order for the person to act effectively. Now, another one is you set deadlines. You set deadlines and monitor progress. You know, if a task is supposed to be achieved within a month, you can give the person 3 weeks. You can give the person you are delegating 3 weeks. You want to know how the person will be able to meet up with the deadline. You know, you can do like a demo for the person in order to know how they will be able to act on your behalf. Then you monitor their progress. You know, you want to monitor how they are behaving. You want to monitor how they are acting. Another one is model the role. You model the role and provide guidance. You have to model the role. You have to act as if you want to do it on the person's place, in the person's place. You act and model the role for them. Let them know the way you want to do it. Let them see you acting. This looks like acting like a drama. It shows the way you want to do it. Let them learn. Let the delegates learn how to do it from you. Then you evaluate performance. You evaluate their performance. You want to know how they performed at the end of the day. Those are the steps in effective delegation. And we see that some managers, they don't want to delegate. They don't want to delegate, maybe due to their past experiences.
Yes,
Maybe they have delegated before and this delegate has failed them. They don't want to delegate. And some of them don't want to delegate due to their selfish interest. They want to do all the work. They want to take all the praise for the good job done. So they don't want to delegate. And we have some managers that over delegate as well. Some of them over delegate. They put all the tasks on the subordinate head. They want the subordinate to do everything while they sit and watch. They don't have time to even correct. They don't have time to even supervise. That's over delegation, which is wrong. Okay, I hope you are following me and I hope you are understanding. Before we move to the next slide, I want you to just take a deep breath and try to recall and see if you can remember what we have been discussing from the beginning. I'll be back shortly. Okay, we are back. I hope you had time to rest and take some water. Okay, the next one is talking about philosophy, purpose, and objective of nursing service management. We want to discuss what mission statement is, what it means to set an objective, what philosophy means, and the likes. So, we all know that in any organization, there is the need for mission statements to be set. There is no organization that will exist without mission statement. There is always a goal. There is always an aim that you want to achieve. Be it a church, be it um, a technology firm, anyone, healthcare system, and the likes. We all need a mission statement. Okay, now what is a mission statement? This is a broad or general goal of an organization as it relates to the community, as it relates to what the community will gain. Why setting a mission statement? You should consider what the community in which you are in will gain. It's not just we want to set up a healthcare system, a primary health center in an organization where it may not, in a community where they may not even need it. Maybe they have enough already. There is a way you set your mission statements and you put in consideration what the community will gain. And this is what we mean by mission statement. For instance, the mission statement of a primary health care center, it may be to serve the healthcare need of the community, while that of a teaching hospital may be, though they are serving the need of the community, but they still want to put research, carrying out of research. They go higher by conducting research. They train students aside the caring for people. So you can see that different organizations or different levels of healthcare system, they have different mission statements. A primary health center cannot say they want to be training students. There is no way they can do that. they don't have capacity to do that. So, but a teaching hospital, a federal medical center might have the need to conduct research. They conduct research and they train people. Please give me some minutes while we sort out one technology technical issue. We'll be back shortly. Thank you. Okay, we are back. I'm very sorry for the break in transmission. We continue with from where we stopped. I have said before the network logged us out that mission statement is a broad and general goal of an organization as related to what the community will gain. That is the community in which the organization is. You to develop a mission statement, how can we develop a mission statement? It is important to that the mission statement contain some elements such as your connections. The mission statements must have purpose and values of the organization. It must reflect the responsibility of the organization towards the client or towards the society. And it must also have the main objective of the organization. You know, we have mentioned that earlier, that the responsibility of that organization towards the society must be reflected in the mission statement that will be set. Then we move on to the next slide, which means that which is the objective of nursing service management. What do we mean by objectives? These are the end results towards which an activity is aimed. You know, an activity, there is an objective for each organization, and this is what we want to achieve at the end of the day. You know, we want to know the goal that we are aiming at. That is what objective means. Objective of nursing service in an hospital setting may include, you know, it may include management of nursing care and service. You know, it may include education, giving education and training to staff, developing staff skills, and participating in research, you know, community research and international research in order to increase the knowledge of both the workers and in order for it to benefit the community. Another function of, we move on to this function of objective. Function of objective, number one is objective defines an organization. It is the objective, you know, when you see the objective of an organization, or like when you are writing a research, you write out your objective. Seeing your objective alone can help us to determine what you are aiming at. We can know what you want to, your end result is likely to be. So objective defines an organization. It tells us what an organization is aiming at. It provides direction for decision making. When you have set out your objective, you know at which point to decide what to do. You know at which point to take a decision on a particular task that you have set in your objective. Then another one, it sets standards of performance. You already know what you want to achieve. Therefore, you have a way by which you follow those the process at achieving those things that you have set. It's make you to be able to follow standard. You be able to follow, you do things in a standard way. Another one is providing basis for decentralization. When you you already know your objective, you already know the standard at which you are aiming at. Therefore, it will give you the room for decentralization. You'll be able to spread out the work to your to the people in the organization, to the person who does that and who does this. Then it also integrates the organization, group, and individual. It gives the individual and the community confidence in how to do their things. Now, we move on to philosophy. Philosophy of nursing service. This is explaining the system of belief that determine how a mission or a purpose is to be achieved. You know, we have talked about mission statement and objective now. Now, what is the system of belief? What's belief? What do we want to know about our mission Okay, sorry again. We are sorry, it's technical issues. We are back again. Okay, we move on. Philosophy, as I've said, is the system of belief that determine how a mission or a purpose is to be achieved. The belief, concept, and principle of an organization is reflected in their philosophy. You know, it's a complex way of putting a mission and objective. It's because there is a belief system in philosophy. It shows how we want to achieve our aim and the mission that we have set using some theories. And as related to nursing care service, there are some nursing theories which has to be put in place in our practice in order for us to achieve that mission statement that has been set. Therefore, we move to components of nursing service philosophy. Under this, we have nursing and nursing practice. And in our practice, as I've said earlier, there is the need for putting in nursing theories, which should be incorporated in our philosophy. It should be incorporated in our practice. And another one is centered around our practice. This is talking about the way we give standard of care, the standard of care we give to our clients. And you know, the way we treat our clients and the mode of our practice is what we encourage people to visit that healthcare system. For instance, if our nursing practice is not standard in, let's take example, a teaching hospital in particular, the nursing standard, the nursing practice they give to patients is not standard. People will withdraw. People will start withdrawing. Clients will not continue to visit them due to this fact. Another one is education. Another one is research. You know, as our practice, during our practice, we meet a lot of things which cause for research. There are some things that we come across that need us, that will warrant the need of going into research. Another one is patient or clients. Part of nursing service philosophy. Number two is patient or clients. We all know the main reason why a health organization is set up is because of the patient. If there is no patient, there is nothing the health workers will be doing there. So our patients is as important as anything. We need to take them very importantly. You know, you examine their patient, putting in place the patient's rights, their bill of rights, why practicing is important. You know, we believe, therefore belief concerning patients' rights should influence in part the institutional policy and practice. Let's say, for instance, an organization is set up in a particular place whereby their belief system is is low compared to what you as the health worker or what you as the manager knows. You need to, while constructing the policy of the philosophy of the hospital, you need to put into consideration their beliefs, their rights, their ethical and cultural beliefs, in order for you not to work in isolation, in order for the hospital not just to be existing without clients or patients. The third one is nurses. Nurses is as important as other health workers. Other nurses, they are the ones that provide all these nursing practice that we have talked about. We all know how important we are as nursing staff in any healthcare organization. And that is the more reason why we should not downgrade ourselves. We should not keep mute while decision is being made, which may affect us. Okay, we move on to standard of nursing practice. Standard of nursing practice, you know, talking about mission statements and how our nursing practice should encompass the ethical and cultural belief of patients. Thereby, we need to study what standard of nursing practice is. You know, knowing our patients is the most important person in the hospital setting. You know, competent nurses are expected to provide safe and ethical nursing care for them. The goal of nursing specialty is to promote, we do nursing health promotion, health restoration, and health maintenance. We promote the health of our patients, we restore their health when necessary, and we maintain their health. We teach them how to maintain their health while we work together with them. So professional standard, what do we mean when we say professional standard? This is a statement about the level of performance of a professional. So therefore, as nurses, we have a level of performance that we are required to achieve in our practice. There's a level of performance we are required to achieve in our practice. And this should reflect the value of our profession. It should clarify what the profession expects from individuals as nurses. And also it should represent the criteria by which the practice is measured. The clients, they have expectations. They are looking up to us. They are expecting something from us as healthcare workers, as nurses. Thereby, our professional standard must reflect the criteria by which our practice will be measured by clients, by our employers, and also by our colleagues. As an individual nurse, when you are acting, when you are carrying out your practice, you must put in consideration the clients that you are taking care of, the person that the company, the organization that employ you, and also your colleague. You should not work in isolation. You should not work as if you are the only one in the place. You have people that are looking up to you for with high expectation. Professional standards are used by registered nurses and nursing professionals. They use it to better understanding their professional obligations. When you know your professional standard, there is a way you understand better the ethics in nursing and all other do's and don'ts in nursing. You have better understanding of them. Then it also supports your continued and competent professional development. Just like Nursing and Midwifery Council has set a standard for us that every three years you have to go for continuous training, in which before they even mandated it that you have to do it before you can renew your license. So it's knowing the standard of nursing practice. You'll be able to, you don't know it, you have it at the back of your mind that there's need for continuous education and professional development. Even when your organization is not organizing any training, you'll be able to train yourself. There are so many online trainings that you can do now to upgrade yourself as nurses. Another one is explain what nursing is and what nurses do. You'll be able to understand better what we do in nursing and what nurses should do and should not do. It also helps you to be able to advocate for changes of policy and practices. As knowing your professional standard, when something is coming to affect your standard, you'll be able to stand against it. When you see doctors in your hospital training quack, you'll be able to stand against it. You'll be able to stand against anything that is, you'll be able to stand against whatsoever that is not in line with your practice and policy. Another one is it's divine and to define and resolve professional practice problem. When you know professional, when you know your profession, your standard of nursing practice, you'll be able to define and resolve any problem in your profession. You'll be able to tackle any problem that comes your way as an individual and as a team. Another one is it is included in nursing education course and program. We all know that in our course of training, there is when you train about the standard of care and the standard of nursing care as professionals. So we move on to what standard of care is. Standard of care as nurses. This simply describe the nursing care according to nursing process. We have nursing process by which we follow, and we all know what the steps in nursing process. We have assessment, followed by diagnosis, followed by outcome identification, then planning, and implementation, then evaluation. We all know these steps are what we follow in nursing process. It defines our standard of care. Any nurse that is practicing now in this dispensation and is not following nursing process is an archaic nurse. The person, any nurse that is rendering care to patient now and without putting in consideration nursing process is a quack. So, in assessment, when we see our patient, we'll be able to assess them. We know the problem they have. It can be objective or subjective. Then, using this data that we have collected from the patient, we'll be able to make their diagnosis. We'll be able to tell them, okay, this is the what you have. This is the problem you have, and we are going to help you. Then you set your outcome. What do you want to achieve? What do you want to achieve? Then, using your outcome, you'll be able to plan. Okay, these are the things I will do in order to achieve my aim. Then you implement the plan that you have set, and at the end, you evaluate. Your evaluation shows if you have really met your aim and if you have followed the standard of care effectively. Under standard of care, it means it reflects all significant actions needed to be taken by nurses in order to give standard care to our clients. And other nursing responsibility include we render care with respect to clients' cultural and ethical belief. These I have said earlier. While we give health promotion and continuous care, we need to put in consideration the cultural and ethical belief of our clients. So we take a little break and come back again. To the next slide now, which is management of human and material resources. Management of human and material resources. As I've said earlier, it is not only human resources that it is needed in management in order to achieve the organizational goal. There is the need for material resources and financial resources as well. Now let's talk about human resource management. This is the process of acquiring and retaining organization human resources through planning, recruitment, selection, and orientation. It's the process of acquiring personnel. How do we get new staff? How do we get new nurses to work in the hospital? This is the process of acquiring human resources. And after acquiring them, how do we retain them in the organization? What are the things that we do as that a manager would do in order to retain the acquired nurses? And the process by which we do this, we do the acquisition is, we have number one, human resource planning. This is the time whereby the manager puts out adverts. They see the need for employing more staff. They want to employ more workforce. And this is driven by the changing environment, growth in the organization. Maybe they are creating new wards and they are creating new departments in the hospital. And there is the need for employing new nurses. Let's take, for instance, a renal unit has just been created in a particular teaching hospital. They cannot just transfer already existing nurses there. They might want to employ renal nurses. They might want to employ nurses that has been trained in line with that. Therefore, the need for putting up adverts for recruitment. And when we are planning for this, sourcing for employee, we can do that using internal sources and external sources. As internal sources is when they do transfer or promotion. Maybe they have just created a private ward now, and they want to be putting medical patients there. You know, they can still transfer nurses from medical ward to work in the private ward, since the work they will be doing will be related. Unlike external sources, whereby they will have to employ people from outside. That is when they want to place adverts on dailies. They want to bring in new people because their services are needed and they don't have anybody internally who can work in place of them. The next one is recruitment. Recruitment means when we start attracting qualified people, and this is done when advert is being placed on dailies for the need of new employee. We attract qualified people and prospective employee for that organization. The third one that follows is selection. What do we mean by selection? You know, we have placed adverts and a lot of people have applied. You know, then you start the process of selection. This can be done checking their resume. You can select them, checking their curriculum, vita A. You can select to see who is qualified for the job. Or you can do selection by conducting pre-employment interview. You can call them for interview. You can, another one is you can give them tests. The interview can be oral and it can be written form of interview, depending on the hospital policy. Then after selection, you move on to orientation. Those people that have been selected have to be given orientation. They need to know information about the organization. They need to know about the structure of the organization. They need to know objectives, rules, and regulation of the organization. This is the time whereby you give them identification badges and you give them, you show them to the unit where they will be working, you show them to the head of their unit, and so on and so forth. Orientation, one of the important reasons why we do orientation is to relieve stress, is to relieve anxiety of the newly employed staff. They are usually anxious, but by the time you take them around the hospital, by the time you tell them about the policies of the hospital, they are calm and they are ready to work for you effectively. And it also makes them to gain acceptance by other co-workers. By the time you show them around the hospital, by the time you show them around the ward they will be working, you introduce them to the staff they meet on the ward, you introduce them to the head of their unit, they feel relaxed and they gain acceptance of their co-workers. You know, we have talked about acquisition of employees now, and we move on to retaining of those employees. You have acquired them. You need to retain them in order for them not to go. What do you want to do to retain the employees that you have acquired? You want to do personnel training. You want to make sure that you continually give them training in order for them to be relevant as the hospital is growing, as technology is advancing, as healthcare system is advancing. You want to give them training. You want to make sure they work efficiently when they know what to do, when they know the new trending thing. It makes them to work efficiently. They will all be happy when they see that their employer is giving them continuous training. And anytime they want to apply for any training, you grant them the permission. They will be willing to work for you continuously. The employees are assessed for the training needs, and these are used to set objectives for training. You know, before you can conduct a training, you first assess the need for the training. Maybe you give your employee a particular task and they are not able to do it they are not able to do it maybe because they are not familiar with it. You want to use that as a way to organize training. Then you set the objectives of this training. You already know what your objective is aiming at. Maybe the objective is aiming at being able to use a functioning machine, for example. You know, maybe you want a nursing staff to use a functioning machine for a patient and he or she is not able to do that. You know, you test like few number of nurses and they are not able to do that. You'll be able to know that there is the need for training them in order to be able to use this machine. Then you set your objective. and you conduct the training program, which should be organized in line with the objective that you have set. And at the end of the day, you evaluate yourself, you evaluate them, you test, you do a retest, which will show that, which will show if they have learned or not. Then the next one is performance appraisal. You want to retain your employee by appraising them. You know, any individual that has done well needs to be appraised. This is a systematic review of an individual employee performance on the job which they have done well. If an employee has done a work effectively, he or she should be appraised. The nurse director or administrative staff must develop a systematic evaluation plan and procedure in order for your employee to be appraised. You want to know, you want to appraise them, you want to develop a system by which you can appraise them and thereby give them either a good or very good or an excellent result. Some of the problem that we have in appraisal is bias. Bias is, you know, when the manager is when the employee is well known to the manager, they might want to give the person a good result in the appraiser. They might want to give the person a very good result, and it may not mean that the person is a perfect person, but because you are related to the person that is conducting the appraiser or the person that is scoring the appraiser report, you'll be able to get a good result. Another problem with appraiser is the tool that may be used, that the organization might be using for appraiser might be faulty. It may not contain some things in which will show the skills of the employee rather. The tools might be faulty in a way that maybe some things that are supposed to be included might not be there. And we have common tools which they use for evaluation. We can use a checklist. Some of us, we use this in our organization. There's what we call annual performance evaluation reports that we do annually. They give us as nurses in order for us to tell the organization that employ us those things that we have done from the beginning of the year till the end. That is, we can call it a checklist. We have a rating scale, and we have management by objective. You might be assessed immediately while you are doing the work, while you are, maybe an objective is set for you and you achieve it, you know, you can be rated with that. We move forward by talking about, we talk about material resources, management of material resources. You know, we have talked about human resources. Now we want to talk about material resources as part of what is going to help the manager in achieving the set goal of the organization. Management of material resources is as important as managing human resources. If you are saying you want to manage only your staff, you want to only acquire staff and retain them, you are negligent about management of your materials, you know, it's going to be a problem for the manager. Because if all your materials are not well distributed or they are not well accounted for, there is no way you can achieve your aim. Management of material resources is done to ensure that the right materials needed are available at the right time. It makes sure that the right thing that we need is given to the right person in order for the person to function effectively. Let's assume now that in a particular, in a labor ward, you have enough nurses in the ward. You have up to like 10 nurses. Your staffs are adequate, but you don't have delivery pack. Is that the right thing? No. There is no way you can work without, your nurses are useless without delivery pack in a labor ward. That is why inventory keeping is needed. One way to manage your material resources, it depends on effectiveness of your inventory keeping. You need to keep inventory. You need to distribute material effectively. And those materials that we manage are divided into two. We have okay now. Sorry, I took a break to take water. Okay, now let's go on. Materials to be managed are divided into two. We have expendable or consumable materials. These are materials that should be regularly kept in stock. They are the things that we need every time. They are used within a short time. You can need them at any time. They are the ones that they are called consumable. You know, in an hospital setting, sometimes they tell the patient that you have to pay for consumables. These are necessary things, such as cleaning detergent, um, disinfectant, and the likes. They are materials that you need every time. So let's assume that you are only managing your human resources, and now you don't have consumables on the ward. Will your human resources, will they be able to work without consumables? No. That is why management of material resources, especially these consumable materials, are also necessary. The second one is non-expendable and capital material. These are materials that you may not need them every time, but they have to be in place. They might be in written form. This can be maintenance of your generator plan, or in the hospital, maintenance of the electricity and all the likes. You know, those ones are not what you need every time. They are not problems that occur every time. So you might not even need the materials for them every time. That is why they are called non-expendable. Management of material risk. Sorry, I'm back again. Management of human material resources continue. How do we manage our material again? This is done through ordering. Ordering means getting materials from the store. As let's take for instance a ward now. Maybe there is a particular day of the week whereby you order for new materials from the ward, which are mostly the expendable and consumable materials. You want to order them from the store. And after doing the ordering, you store them. That is when you label them, you put them in place, in the right place. Those ones that are to be used immediately, you dispose them and they are being used. And those ones that are to be labeled and put in the right place are stored. Then another one is issuing. You want to give out those materials when necessary, when they are needed. You want to give them out to the right person to be able to utilize them. Then at the end, you control those materials. You have to be in charge of those materials. You monitor their use. You monitor the way they are being issued. Then you do maintenance, you maintain them and you repair them when necessary. When we talk about repairing, we are talking about those materials that are non-expendable. You want to maintain your generator, the hospital generator, you want to maintain them and repair them when necessary, in order for it not to give you problem when they are in use. We move on to the next one, which is time management. Time management. As we have said so many times, I've mentioned it, that it is not only human resources that you manage. It is not only material resources that you manage. You also manage your time. Any manager that is not able to manage his or her time should not be called a manager. One of the most important resources to manage in an organization is time, because time is not renewed, cannot be renewed. Any time that has been lost cannot be reversed. So as a manager in an organization, you must be able to display good time management skill. And what are the steps that you need to take in managing time? Number one is you have to set your goals. A manager has to set goals. When goals are set, time are assigned for each goal to be accomplished. And when we mean this, we talk about short-term goals, medium-term goals, and long-term goals. There are some goals that are needed to be achieved within a short time, and the work needs to be done immediately. Setting your goals help you to be able to prioritize which should come first and which should be the next, and at what time each one should be done. That is setting of goals. And the second one is planning time arrangement. When you have set your goals, you assign time to them. You arrange the time. Is it an event that you want to be doing daily? Is it the work that you want to be done weekly, monthly, or yearly? You want to put time for your goal. You want to assign time either yearly, either daily, or monthly. And when you are doing this, it depends on the frequency and regularity of such events. You cannot say you want to be making the patient's bed weekly. It's not possible. You know, we all know that any patient needs a change of bed either every day or every 2 days in order for them to be comfortable and in order for our care to be effective. And you will not say you want to be running nurses week program, nursing program every month. You might have to do it maybe quarterly, or you want to do it every year. Just like we celebrate nurses every May 12 of every year. You know, that's planning your time arrangement. Then you can do that using your roster, the timetable. You schedule your work at a needed point in time. And the third one is preparing a health unit timetable. You want to prepare your health unit timetable. Maybe it is the head of nurses that sets the time arrangement, as we have said in number 2. Now it wants to come down to the head of the unit. You prepare your health unit timetable. Okay, now they have told you that you have to be doing, you have to be giving your patients health talk every once in a week. You want to fix which time of the week, which day of the week you want to choose as the unit. You want to put head together as member of the unit to decide and plan how you want it to fit into your already stated timetable. Maybe you want to know if it should be early in the morning while you are changing their bed. You want to know whether it should be during the afternoon shift, or at what time you want it to be, which will fit into your already set timetable. Then the next one is preparing health unit schedule. As a unit, you differentiate your activities, you list them and schedule them on your timetable as per who to take it and when they should take place. You have set your time. You want to know who should take it and at which day of the week or at which month or year. Then you want to go to number 5, which is preparing your duty roster. Now you have set your health unit timetable. You want to do the roster in such a way that it will be a fair and even one. You don't want to put a hard task for a particular person and the person who kept on being the one doing that task every time. You want to share the task accordingly. You want to make sure that difficult tasks are given to different people at different time, not the same person at every time. You want to assign the person that will be, let's take example, you want to assign the person that will be doing the duty, that will be giving the health talk, as we have been using as an example. You want to assign the person to do this, and you want to make sure that the person is not off duty on that day when the person will be doing the health talk. So time management, as I've said earlier, is very important as other resource and material management. As a manager, it is important to display good skills of time management. We'll continue from the next slide in a short while. Okay, as a form of conclusion for this first part, I want to say that gone are the days when nurses have to keep mute when they are making decisions at the top of healthcare system. With this knowledge of management that you have acquired, with this knowledge of administration that you have acquired, you'll be able to know that at your own level, you are a manager. At your own, even as the least nursing staff, you are the manager. You have a particular thing, a particular work that you have been assigned to do. Therefore, you are the manager in your own way. Therefore, we need to participate in any decision making which is being done in healthcare system. Thanks and God bless you. Very soon we'll continue with the next session. You are all welcome to the second part of this NSC 406. I will just run through these slides. And the first, we want to talk about concept of quality in healthcare. What are the concepts of quality in healthcare? We all want to give quality care to our clients. As we have said earlier about standard of care that we give to our clients, that it determines their patronage. When we are not giving quality care to our clients, they tend to withdraw from us. Now, what is quality? What do we understand by quality? This is excellence of a product or service, including its attractiveness, lack of defect, reliability, and long-term durability. So we can say something is quality when it is excellent. When a product is excellent, you can say it is quality. When it is attractive, when it has no defect, or when it is reliable, you can refer to it as a quality product or service. And quality also is meeting or exceeding the requirements of a customer or a client. As I've said before, our clients, they have expectations. They have what they are expecting. They have what they are expecting when they go to primary health center, and their standard will be, their expectation will be higher when they go to teaching hospital. When you now exceed their expectation, you perform above their expectation, we can say you are giving a quality service. The next one is who is a customer? This is someone that use our product. As nurses, our clients, our patients, they are our customers. As I've said, that they are the most important in any health organization. So they need to be treated with utmost importance. And what do we mean by quality assurance then? Quality assurance provides the mechanism to effectively monitor patient care. When there is quality assurance, you want to monitor the care that you are giving to patients. You want to monitor the care that a healthcare professional is rendering, if it is effective, if it is quality enough. You use cost-effective resources in order to carry out quality assurance. Then, what are the concerns of our clients and customers? What are their concerns? What are their fear when they see any healthcare organization? They are concerned about accessibility and availability of a service. They want to know if they will be able to access a particular service. Maybe they have heard about that service in from someone that is far away from them. They have told them about how pap smear is being done in order to test for cervical cancer, but they want to know if it is accessible in their the teaching hospital in their vicinity. They want to know if the service is available. They have the fear of, even if it is available, will it continually be available and accessible? Then they want to know if the service that you want to give them will be timely and safe. They want to be sure that they are in safe hands. They want to know if everything they will be receiving will be timely. They will receive timely help. A woman in labor wants to know if when she gets to the hospital, she wants to know if she will be promptly attended to. Another one is coordination and continuity of care between service. They want to know if you as health worker, you are coordinated, if there is cooperation between you and other health workers. They want to know if there is team spirit within you as health workers, which will in turn help their own care. And another one is effectiveness of services, that is the delivery and outcome of the care. They want to know if the care you have given them will be effective, if it will work for them, if truly you have helped them to, if a surgery has been done on angiography, for instance, they want to know if they will not experience the pains that they were experiencing before. They want to know if the service you are giving them is effective. You know, we have different types of consumer of healthcare service, apart from our clients and different people can be clients. It can be their families as well. It can be the community, can be our consumers as well. Then one major consumer of healthcare is the third party payer. These are people like the insurance company who manage care organization and federal and state government. They are also consumer of healthcare, but they are third party. You know, insurance company, non-governmental organization that are health related, they are also our consumers. For instance, NHIS, they are one of our customers as healthcare providers. We want to talk about the diversity of needs represented by these consumers require improvement in healthcare delivery system. You know, different kind of needs that they tell us, you know, when they tell us these are the things that they need, it helps us to be able to change our way of delivering our services. In healthcare system, it is important to put in place legal and ethical consideration. We all know that we have ethics in nursing and we have legal aspects of nursing. There are laws and regulations that are created in order to monitor our quality of service. You know, laws and regulations are created to monitor our quality of service and the quality management. Failure to provide quality health care can result in lawsuit. We all know we all know the penalty that negligence as a breach of health service. We all know what it attracts. You know, when a patient is being neglected, we all know the punishment that is attached to it. Then we have institutions can also face liability for actions taken against a practitioner if objective measures are not applied to performance and due process is not provided. An institution can also be sued if a healthcare professional is not being provided with all needed materials for their practice. So also a patient can also sue an organization for not giving them quality care. Let's move on to case law. Case law refers to the legal opinion rendered in court case. Several landmark cases have established the following issues within the quality management movement. We have hospitals are liable for the care provided to their care. These are under case law. These are the things that the hospital or organization needs to know. They have to know this in order not to be sued by the clients. Hospitals are liable for the care provided for their clients. Hospitals are also responsible for department practice. You know, each department has their mode of practice. It is the hospital that is responsible for disseminating the information to them. These are the way you practice. Limited immunity for peer review exists. There is the need to review quality assurance. Approaches for quality assurance program. This is another subtopic. Approaches for a quality assurance program. Two major categories of this approach are we have the general approach and we have the specific approach. Under the general approach, this involves governing of official body evaluation of a person or agency ability to meet established criteria or standard at a given time, at a given point in time. You know, there is a general approach of measuring quality assurance. You know, individual official body will be evaluated. Maybe the healthcare organization will be evaluated. That is the general approach. Under that, we have credentialing. Credentialing is when a formal recognition of professional or technical competence and attainment of minimum standard by a person or agency. This is when you give the person a authority to act as a professional. You license the person. Another thing is licensure. Licensure is individual license is being given. Individual is being given license as a contract between the profession and the state. Maybe the state gives the profession. We all know that nursing and midwifery council, they issue us license when we are being qualified. They give us license as professional. This is also a form of quality assurance in order to ensure that it is only qualified people that are licensed. Another one is certificate. We all know that at the end, you all know that at the end of this your program, you are aiming at achieving a certificate, a Bachelor of Nursing Science certificate. This is what we know as certification. Under specific approach now, we have peer review. Peer review. This is when the recipient health service is being audited. You know, the recipient of health service by means of auditing the quality of service render. They audit the quality of service they render. It is the recipient, those that are receiving your health service are the ones that will review you. They are the ones that will conduct the quality assurance. That means your patients are the ones that will do your review. Another one under peer review is health professional evaluate quality of individual. It is health professionals, outsiders that come to evaluate you. They want to know if you are in line with the quality. Now we talk about standard. You know, we have talked about standard of care earlier. Now we want to talk about standard as a device for quality assurance. Standard is a predetermined baseline condition or level of excellence that comprises a model to follow. You know, standard is like what we have set in order for us to follow line by line in order to achieve our goal. And we have the first standard under quality assurance is collection of data. They collect data about health status of the patient continuously or systematically. And the next one is nursing diagnosis. You collect, you know, this is just like our nursing process. After collection of data, which is then you move on to diagnosis. You diagnose the patient based on the data that you have collected. Then the next one is planning of nursing care. This includes the goals derived from the nursing diagnosis. You plan towards what you want to achieve. Standard 4 is plan of nursing care include priorities and prescribed nursing approach or measures to achieve. You want to know what you want to achieve. Then the 5th standard is action. That is when you take action in promoting of your patient's health or maintenance or restoration. Then the standard of number 6 is when the nursing action will assist the patient in maximizing their health capacity. You want to know if your action is helping the patient or not. Standard 7 is you want to monitor your progress. When there is lack of progress towards your goal, you'll be able to go back from assessment. Quality assurance process. What are the processes that need to be following under quality assurance? Number 1 is establishment of standard. You establish standard. And when you establish standard, you identify the information relevant to criteria. You want to identify the information relevant to criteria. You want to determine ways to collect information. What are the ways you want to use to collect your information? You collect the information, you analyze them, and you compare the collected information with established criteria. You know, you already have a standard set. So the information that you collect, you want to compare it with your established criteria. Then after that, you make judgment. Based on the criteria that you have measured, you make your judgment about the quality. Is your quality in line with the one that you have set? Is it in line with your professional standard? Then later you provide information when necessary, you correct when necessary, and you give corrections and appraisal when necessary. Then the next one is you determine the way to collect. Factors affecting quality assurance in nursing. What are the things that can affect quality assurance? When there is no resources, there is no way you can perform effectively. Therefore, it will affect quality assurance. Personnel problem. When personnel are having problem within themselves, they will not work hand in hand. Therefore, the quality of care they are given will not be effective. Improper maintenance. When you have materials and instruments that are not well maintained, even when your human resources are not well maintained, there will be a problem in your quality assurance. When there is unreasonable patients and attendants, when there are, we have different kind of patients. There are some patients that will not comply with whatsoever you tell them. It makes, when you tell a diabetic patient not to take carbohydrates of a particular calorie of carbohydrates, and they deviate and they start taking them, it makes your work not to be effective. It will be as if you are not giving the correct education. Absence of well-informed population is another problem. When your population is not well informed, when they are not learned, or when they are not aware of that particular information you are passing to them, it will affect quality assurance. Absence of accreditation law. When there is no law binding you, when there is no law binding the organization, they do things anyhow, and thereby there will be problem with their quality assurance. Lack of incidents review procedure, lack of good and hospital information system, and lack of nursing care record. When there's no record for all the care you are giving, there's no way you can reflect back to them in order to measure your quality assurance. What are the roles of nurses in quality? What are the things that we have to do as nurses in order to improve quality of care that we give to our patients? As nurses of nowadays, we all know we are aiming at being at the top. We want to rub shoulders with other health professionals. We want to be at the top. What are our roles then to make sure that we are giving standard care? Number 1, nurses must ensure that mechanisms for monitoring and evaluating care are under scrutiny. They must make sure that the evaluation tools that we are using, they are under scrutiny. What are the things that we must make sure that we are monitoring and evaluating our care in order to be sure that they are in line with our objectives or the objectives of the organization. Individuals within the profession must assume responsibility for their professional action. Individual nurses must be able to take it up on their self that this is my profession and I must be responsible. Not that we should act as if we are not the manager or we are not the ones to be blamed for any action. We should also take it upon ourselves to give effective care. Another one is allowing individual practitioners to demonstrate their competence and expertise. We must be able to allow others to demonstrate their work We should work hand in hand with other professionals. This will bring out our own work as well. Nurses should monitor for early recognition of adverse effects, complication, and error. We should not sidetrack errors and adverse effects. We should identify them as early as possible, tackle them, and correct them when necessary. How do we evaluate response to care? How do we want to know if our patients are enjoying the care we are giving to them? Evaluation by means of definition is the measurement of degree to which objectives are achieved. It is the measurement of the degree to which the objectives are achieved. You know, from time to time, a standard organization must evaluate themselves. They must evaluate if they are meeting the needs of the community. Therefore, you measure your care to the ones you have set. You measure what you are doing to what you want to, against what you want to achieve. Evaluating of care given to clients is also is an essential part of professional nursing practice. We must be able to measure the practice we are giving to our patients. Evaluation is a planned and systematic process which compares the client's health status with the desired expected outcome. You know, when we are doing our nursing process, we used to plan. We set we identify our outcomes, and at the end of the day, we evaluate. You'll be able to compare the results you get at the end of the day with the outcome that you set initially, to be able to know if the patient has benefited from the care you have given. What are the purpose of evaluation? Why do we need to evaluate? Why do we need to evaluate as individual nurses or as a healthcare organization? We need to evaluate in order to monitor our client's progress, because lack of progress will make the organization to be going down. When the patient comes to the organization or to the healthcare system and they leave the same way, or in a short while they come back developing the condition that took them to the hospital initially, they have problem. Then to determine effectiveness of nursing care in helping patients, when we evaluate, we'll be able to develop new plan, we develop new care that we want to give to our patient. We determine the overall quality of care to be provided. We determine the care that we have provided, and we'll be able to promote accountability. What are the steps we take in evaluation? We establish standard. You establish standard as during evaluation. After that, you collect data. You collect the data related to the goal that you have set, and you follow the standard that you have set initially. You collect data. Then you relate your nursing action to client status. You set your nursing action. What are the things that you want to do related to the client that you are taking care of? Then after that, you judge the value of nursing intervention in assisting clients to achieve goal. You'll be able to judge your value of nursing intervention. Then you reassess the client status and modify your plan of care when necessary. If you are deviated from your line of care, you'll be able to remodify. Another aspect that needs to be evaluated in healthcare, in determining quality of healthcare, is appropriateness. Appropriateness. This is the care provided. You want to know if the care that you are giving is appropriate. If it provides standard and is resulting in achievement of goal. You want to know if you have not deviated from what you have set. Another one is clinical outcome. You want to know if your clinical outcome is also in line with your set standard, and if it is quality enough. Evaluation and accountability. What do we mean by accountability? How does accountability relate with evaluation? That is what we want to discuss now. Accountability means assuming responsibility for one's action. As a nurse, you know, whatsoever care you give, whatsoever procedure you carry out, on a patient. You are the one accountable for that procedure. Any action that comes out from it, either positive or negative, you are the one that will be responsible for it. Therefore, you are the one that is accountable. Evaluation enhances nursing accountability by providing a mechanism for assisting the nurse to define, to explain, and to measure the result of nursing action. You know, when you evaluate, you'll be able to enhance your accountability. You'll be able to know that you are the one that will define, explain, and measure the result of your nursing action. Nurses demonstrate their commitment in a variety of ways. Different ways by which we demonstrate our commitments are as follows. We maintain expertise in skills. We maintain expertise in skills. We participate in continuing education program. You know, we achieve and maintain certification, and we also participate in peer evaluation. Let me take some water before we continue. Another one is client satisfaction, then cost effectiveness, access to care, and availability of resources. Let's move on. This is an important aspect, and it is communication. Communication, we all know, is very important in healthcare system. When you communicate, you want to hear the feedback. You want to know if you have communicated effectively. And by way of definition, communication is any act by which one person gives to or receives from another person information about that person's need, desire, perception, knowledge, or affective state. You know, communication is when you pass information across to someone or you receive from another person. You want, when a patient communicates their problem, when they communicate their need or their desire to you, you'll be able to, that is when communication has taken place. There are there are 3 levels of communication as related to management. We have intrapersonal, interpersonal, and group communication. You can get the further explanation of that in your notes. Communication process. Let's move on. Communication process. The intent of communication is to elicit a response and of the process that is ongoing. The receiver of the message then becomes the sender. You know, there is the receiver of the information, there is the sender of the information, and there is the message on its own. That's the process of communication. There is the sender, there is the message, and there is the receiver. Let's take, for instance, now, you want to give health talk to your patient on personal hygiene. You as the nurse, you are the sender of the information. Those information you want to pass across to them, maybe brushing of their teeth, cleaning of their environment, those are the message. Those are the messages. And your clients, those listening to you, they are the receiver. Therefore, a communication will require a message. There is no way communication can take place without a message. We have the source, who is the sender. We have the channel as well. Which channel are you using? Just like we are passing information to you now, we are using technology-driven way in order to pass on this information. We have the receiver, which you are one of the receiver as well. Feedback or response, which is going to be at the end of the class. You might want to ask a question or contribute. That is the feedback. What are the mode of communication? We have verbal. One of them is verbal communication. non-verbal communication. Under verbal communication, we have the information must be in a pace. It must move in a pace. The intonation is important. It must be put in place. You know, we all know that someone that is stammering might not be able to communicate well, to might not pass across information as someone that is sound, that the speech is sound. We have simplicity. Any information you want to pass across must be as simple as possible. It must be clear, it must be brief, it must be timely and relevant. There must be adaptability and credibility. We have non-verbal communication. Non-verbal communication, that is facial expression. You want to talk to someone, you are using your facial expression to talk to the person. A patient might be showing a sign of pain through when they frown their face, when they are groaning in pain. You know, through their facial expression, you can determine if they have pain or not. A hungry person might communicate facially. Posture and gait, someone that is not walking uprightly, you can deduce from that maybe the person is passing information across to you that is even having a low back pain or whatsoever. Personal appearance, when you see a roughly dressed person that is not tidy up, person that is not that his personal hygiene is not effective, you can pick up information from that and say maybe the person is neglecting his or her personal hygiene. You can link it to further information, might give you good information about the person. Gesture and touch. When the person is touching you, you might be communicating. An effective verbal communicator must possess the following characteristics. If you want to pass across information effectively as a good communicator, these are the following characteristics that you must possess. Clarify, clarity. The person must clarify any issue, any information that he or she is passing across. The person must listen. He must be a good listener. Must encourage emphatically, must encourage, like I'm encouraging you now, that are you listening to me? Are you participating? Hope you are getting what I'm saying. A communicator must be able to encourage the audience. You must acknowledge. You must acknowledge. When you are passing information across to the person must acknowledge the information. You must restate and repeat the information. For non-verbal communicator, someone that is passing across non-verbal information, or the person must be relaxed. You must relax and you must open up. You open up to the person using your non-verbal way of communicating. You lean towards the other person. You want to lean towards the other person. You want to ensure eye contact or body contact in order for the person to get what you are saying. You want to show appropriate facial expression. What are the factors influencing communication process? Factor that can influence a communication process. Development is the first one. Gender can influence communication. Values and perception. Personal space, territoriality, roles and relationship. Time, environment, interpersonal attitude, and so on and so forth. What are the barriers to communication? What are the barriers to communication? Before communication can take place, it must be barrier-free. Agreeing and disagreeing, being defensive, challenging, and probing. Testing, rejecting, changing topics and subjects, unwanted reassurance, passing of judgment, giving common advice. Those are the barriers for communication. Therapeutic communication now. What is therapeutic communication? It's a form of psychotherapy that uses verbal or non-verbal technique to communicate with clients. Importance of therapeutic communication: it impels the feelings of comfort in the face of patients. It makes patients to be more comfortable. It increases their self-worth. It increases their self-worth and decrease their psychological distress. What are the ways that we can facilitate therapeutic communication? How can we facilitate therapeutic communication? We maintain patient-centered teaching. Make sure your patients are you carry them along when you are teaching them. You suppress prejudice. Maybe you have something against what you are teaching, you must be able to suppress it in order to pass a good information across. You create a therapeutic environment for your client. You must be alert to non-verbal clue. It might be signaling to you that maybe they are tired or they want to ask questions. You must be alert. You establish a trusting relationship. Let them be able to trust you. Another one is interpersonal relationship. Interpersonal relationship. This is a strong, deep, or close association, acquaintance between two or more people that may range in duration from brief to enduring. Another thing about interpersonal relationship they are formed in the context of social, cultural, and other influences. You know, the context can vary from family or kinship relationship, friendship, marriage, relationship with associates, work, club, and places of worship. Those are interpersonal relationships. Phases of interpersonal relationship according to Peplon. We have orientation phase, whereby the nurse introduces himself, does not look like a stranger. You begin by making sure that they trust you. You build trust. Then working phase. Working phase is when you start your work, you start planning, then you do exploitation. There is exploitation place. That is when you use your professional assistance for problem solving alternatives. Termination phase, that is when uh, you end your relationship. You need to end your relationship. There is need for termination. When you have care for a client and the care has been successful, the client has recovered, you make sure you terminate um, your care. Peplus 6 nursing rules. Let's quickly move on to Peplus 6 nursing rules. We have heard about Peplus from our 200 level in our developmental psychology. So I will just read this out, and you'll be able to read the. Okay, now the first one is stranger. Then another one is resource role, teaching role, counseling role. Those are our work as nurses. I hope you understand what I'm saying. We are the one, we are the one that meets stranger. We meet stranger. The clients are first our stranger. Then resource role, we answer their question, we interpret their questions. Teaching role, we pass out training, education to them. Counseling, we act as counselors. We guide them, we encourage them to make changes. Maybe you want to change their lifestyle. Surrogate roles, we help clients to clarify domains of dependence, interdependence, and independence. We act on clients' behalf as an advocate. The leadership role, we help clients to assume maximum responsibility for meeting treatment goals in a mutually satisfying way. We act as leader in place of our clients. Now we have come to the end of the class. Now, as I have said earlier, our role as nurses, now that we have knowledge of management, is for us to be able to participate in decision making in our organization. I will want to entertain question now. And if you have question, you can raise up your hand. I will see you and I will be able to hear your question. Thank you. Okay, Olajumoke Owoseye, you raised up your hand for a question. Can I hear your question now?
Good afternoon, ma.
Good afternoon.
Thank you for the wonderful lecture. I just want you to, I observed that you didn't talk about organizational charts, stroke structures. So I want to know if we don't need that. Organizational charts / structures. Hello?
Okay, Olajumoke Owoseye, I heard your question talking about organizational chart, and you are asking if you should disregard the the note under it. Well, you have to read that on your own. I believe we all know about organizational charts. That's the hierarchy. The way in an organization there is an hierarchy. We all know that there is the chief medical director, followed by maybe the admin manager and the head of nursing, and so on and so forth. So I assume you know about organizational charts. That is why I did not mention them when I was talking about organizing. Thank you. Okay, Miss Ronketo Sin, I want to hear your question. I saw that you raised up your hand as well.
Yeah, thank you, ma. Good afternoon, ma. I want to appreciate you for the presentation, even though there was a network problem, we still had the best. But please, ma, for the sake of this exam, as you can see, number one, it is voluminous a bit, and it looks abstract. Please, ma, I just want to beg if you can just give us a little area of concentration so that we know where to read the more, where we can just put more effort and energy in reading so that we won't just read astray. Thank you, ma.
Ronketo Sin, your question is a bit funny anyway, but what I would say is, you know, the type of question you'll be, the type of exam you'll be doing, it has objective questions, it has fill in the gaps, it has true or false. So there is no way we can really say you should concentrate on a particular topic or a particular study session. But I want to assure you that reading all these slides and the video that you have, that you'll be able to see at the end of this class should, should be enough for you. But as well as I have said, filling the gaps and objective questions or short essay exam might not have area of concentration. Thank you. Hello, Mr. Muhyiddin, can we hear your question?
Yeah, good afternoon, ma.
Good afternoon.
Thank you so much for the wonderful lecture so far. Please, the pattern of the going to be a theory section or just the OBJ and filling the gap? Thank you.
You are going to be writing, as I've said earlier, objective questions, fill in the gap questions, true or false question, and short essay questions. Short essay, as just maybe you will be asked to list a particular point. You might be asked to write short notes on some things. It's going to be as short as possible in order for you to be able to answer them as quick as possible. Thank you. Mr. Kenneth, can we hear your question?
Okay, good afternoon, ma. Hello, can you hear me?
Yeah.
Okay, thanks for the lecture. Really appreciate. But one thing I want to plead that if the recorded version can be sent to us via WhatsApp so that we'll have it like that of yesterday, it was very helpful.
Okay.
Reason being that some of us, due to network issues, were being logged out, and some other time we couldn't hear clearly, and some of us as well too are on duty, so you may be distracted one way or the other while you try to listen. Thank you, ma'am.
Okay, we have put all that in consideration, as you all know that LAUTECH ODL, we are the best. So we have all this recorded for you, and as soon as possible, you'll be able to get them just like that of yesterday. Thank you.
Thank you very much, ma'am. We'll be grateful.
Adefil, I hope I got the name correctly. Adefil, you are the next. Can you ask your question?
Good afternoon, ma.
Afternoon.
Well done, ma. Please, ma, I want you to explain better how gender affects or influence effective communication.
Okay. That depends on the information you want to pass across. If the information, when the person that is passing across the information is talking about, let's take for instance, the person is talking about reproductive system of talking about cervical cancer or the likes, and the people you are talking about as they have the audience you are talking about, there are a lot of male participants there. You even when you are communicating, they won't understand. So you are not passing the information across effectively. And another thing is, okay, talking about that reproductive system again of a female, and it is now the male nurse that is taking the health talk. Do you understand? If a male nurse is the one giving health talk on maybe breastfeeding to patients that comes for immunization, it won't be as effective as being a female nurse. That is why it is very important. Why, as a manager, why doing your scheduling or timetable, you must put the right person to do the right thing. I hope you understand. Hello, Mr. Olanla, can you ask your question?
Good afternoon, ma.
Afternoon.
Thank you very much, ma, for your time and for the lengthy lecture.
Okay.
Mine is just an observation, ma.
Okay.
That in the discourse of communication, you mentioned the source, the channel, the receiver.
Yes.
And there must be a message. And you eventually mentioned the simplicity of the message.
Yeah.
So I think I deduce it from here that when the communication is given, from the person that is sending, it should be simple enough for the receiver to be able to decipher or understand what the communication is all about. And an effective action must be taken from the communication process across. That is when there will be a communication. That was not mentioned, ma.
Can I hear that again? Sorry.
A message sent
Yeah.
from the source through a channel to a receiver. You mentioned it should be very simple enough.
Yes.
That means the receiver should be able to understand it. And for the receiver to understand or to show the receiver understands the message sent, an action must have been effectively taken that
Okay.
is incommensurate with the message sent. That is when there should be a communication. I said that
Yes.
was actually not mentioned, ma.
Okay.
Because a communication sent, a message sent, and the receiver is acting differently to what was sent, definitely there is no communication.
Yes.
Thank you very much, ma.
Thank you for the observation. Thank you.
All right, ma.
Yeah. Adioye. Uda.
Okay, Adioye Uda.
Hello, Adioye Uda Boluwatife. Can we hear your question? Adioye Boluwatife.
Good afternoon, ma'am.
Good afternoon.
Thanks so much for the lecture given today. I really appreciate it. My
Thank you.
question is just in form of the. I just want to ask question concerning the written form that the exam is going to take.
Okay.
Considering some of us that are actually not good fast at typing, because they said we're going to have like a short essay form. So how will that be able to, how are we going to meet up with the time that will be allotted during the exam period?
Thank you for your
And then
question.
is it going to be like, are we going to type, or we're going to write it and scan and upload into
Adioye,
Yes,
you
sir.
are not writing it and scanning it. You are going to type it. That is why we call it short essay. So it's not, we are not expecting you to be telling us history. So assuming the question says list 10 ways of communication barriers. So the only thing you need to do is just list those 10. We are not asking you to tell us the history of communication. So it's very simple. It's a very short essay. Thank you.
Okay, thank you, sir. So you are assuring us that within the
It's
stipulated
part of the
time, we'll be
exam.
able to, sir?
It's part of the exam. Start familiarize
And what,
yourself with your system.
okay, all right, thank you, sir.
Hello, Kehinde Kolawole, you are on. Can we hear you? Kehinde Kolawole, can we hear you?
Thank you, ma.
Yeah.
Going through the roles of the management under the nursing services, there is no planning there. Does that mean that as nurses we are not planning?
Can I get your question again, please?
Going through the various functions of the management under the nursing service administration, there is no planning under the functions. Does that mean that as nurses we are not planning? Then my second question is that the last study sections, You didn't talk about it. Should we just be silent about it for the exam purpose? Thank you, ma.
Well, you're Adam. Once you full. Kende Kolawole, thank you for your question. Let me start from your last question. We cannot talk about everything here, and not mentioning anything about last Thursday session does not mean you should not read about it, please. We cannot actually talk about everything here because of our time, because we still have other lectures. So that is why we decided to stop there, but you still have to read your last study session. Then your first question, you all know planning is important in every aspect of administration, in every aspect of management. You can count how many times I mentioned planning as much as possible. And even in our nursing process, we all know that planning is there. We have to plan before we take action. So not mentioning it under nursing administration, nursing service does not mean you are not to plan. I hope you understand that. Mr. Otatuyi Isaiah, can we hear your question?
Yes, ma'am. Thank you very much, ma'am, for the lecture. Please, I just have a question. And the question is about what's the difference between evaluation, standard, quality assurance, and performance appraisal. They all look like, but I don't seem to understand the difference between them.
You mean difference between evaluation and what?
Audit, standard, quality assurance, and performance appraisal.
They are all very different. When we talk about evaluation, you want to compare your outcome with your set objective. You want to compare what you have done, what you have achieved with what you have said earlier. Do you understand that? You know, when in nursing process, we do evaluation last. After you have achieved, you have finished your care, you want to evaluate what you have done. You want to know if it's in line with your set objective or your intended outcome. Do you understand what I mean? I think there's a problem with your network. I
can hear you, ma.
Okay.
I can hear you, ma.
And you said quality assurance. Well, quality assurance is when you it's like a tool that you use in checking your standard, if you are still in line with the standard. Quality assurance might not be done by yourself. It might be an external person that will do quality assurance. It might even be your consumer of your care that will do that for you. So it is a form of evaluation, but it is not done by you alone. It has to be done by an external body. I hope you understand. Ms. Adenike, can you ask your question? Can I hear you, Adenike? This is the last question. Mojisola, can we hear you? Hello, Mojisola, can we hear you? Okay, I think we are having a lot of network issues. So we might have to stop here. And if there's any other question, you can drop it on the WhatsApp page or the chat room here. Thank you. See you on the exam day.